All right. Welcome to the Horse Reviews from the Experts conversation with Kentucky Equine Research. We are talking about fall laminitis today. I'm Lauren Abbott. I'm the publisher of the Mid-South Horse Review, and I'm excited to be joined by Katie Young, an equine nutritionist with Kentucky Equine Research. Katie, how are you?
I'm good. Thank you.
Good. Just to give our audience some background on you, on Katie. Katie received her bachelor's degree from Missouri State University in biology with minors in animal science and chemistry, and earned her doctorate from Texas A&M University in equine nutrition and exercise physiology. Her graduate research focused on mineral balance and resting and exercise horses and the effects of fat-added diets on sweat production in working horses. And I want to talk about that in the future too. Young was a member of the TAMU Equine Science faculty for several years during and following her tenure as a graduate student. Since leaving academia, she has spent nearly 30 years in the feed industry as an equine nutritionist, horse feed program manager, a business consultant for Farmland Industries, a large regional feed company, and then as a technical equine nutritionist and horse feed product manager for Purina Animal Nutrition. She has extensive experience in horse feed formulation, quality control and production, customer service and communications, sales and sales training, marketing and regulatory and labeling requirements for equine feed. You're just the full package, jack of all trades.
I did all sorts of things. Yeah.
She was highly involved in every aspect of the product development and launches, both at Farmland and Purina. She now works as a consulting equine nutritionist for Kentucky Equine Research, and also provides independent consulting services for horse owners and veterinarians. So a huge thank you to you, Katie, for taking time today to talk about fall laminitis. And also to our sponsor, Kentucky Equine Research. Just a quick background on KER, not KER. KER is an international equine nutrition research and consulting company serving horse owners and the feed industry. The company advances the industry's knowledge of equine nutrition and exercise physiology, applies that knowledge to produce healthier and more athletic horses, and supports the nutritional care of all horses throughout their lives. You can learn more about Kentucky Equine Research at KER.com. So super excited to talk with you about fall laminitis. Before we started recording, Katie and I were just kind of talking about some of our own personal horses. I had a little miniature pony that was PPID, and he suffered from laminitis, specifically always in the fall time. And I have another 15-year-old Mustang now that looks like he might be developing some metabolic issues. So I'm really excited to talk about this for myself as a horse owner, but also I think not the bulk of our audience, but I think it's going to be very informational for our audience. And I know that there are several readers out there who are constantly managing their horses with special conditions that make them laminitis prone. So just to really get started, Katie, you're going to share some slides and we're going to walk through, right?
Right.
Perfect. But yeah, just getting started, really the rundown of what laminitis in horses and ponies is as a whole.
Yeah. And it's a big topic. I could talk about it for hours, but yeah, we're not going to talk for hours today.
Right.
So just starting, and of course it's now, I'm going to stop sharing and go back because the presentation froze. Okay. So we will open the presentation from a different route. And now it says, okay, fine, I'll go it this way.
It's technology.
Technology is always fun. Yeah. There we go. Now we're on the second slide, which is actually my bio slide. Now it's going to let me go full screen. Maybe will you? There we go. So yeah. I always have a bio slide to just let everybody know. Yes, I feed horses too. These are mine. And the Palomino Appaloosa, I'm basically an eventer now, but I spent about 30 years in hunter jumpers, primarily in jumpers. And then I got older and have back problems and my knees aren't great. My eyesight isn't too good, all the things that come with aging. So I made the logical transition to eventing because, that death wish.
Yeah.
So yeah, the Palomino app was my primary eventer, and then he developed a fibrotic myopathy, and he can still jump, but I really can't show him anymore because he'd probably be eliminated in dressage, and who wants to pay money and have that happen?
Right.
So the guy in the middle, I always like to point out this dude. His name is Boo, and he is now 36 years old. And so this is a picture of Boo and I, probably 15 years ago. And this other little picture here is Boo a couple weeks ago. He's 36. He's still giving lessons because I still do some training and lessons for fun. So
Amazing.
Boo is now giving lessons to a young lady from Ukraine who her family was able to get over here, and she wanted to learn to ride, and Boo likes having a job. So
That's
that is all excellent.
Yes.
So, and then over here, this is, I spent about 7 years being the equine nutritionist for the Budweiser Clydesdales. So that's always really fun.
That's so fun.
Yeah, and then this guy is younger dude that I've been riding. He's now 8. And of course, since again, as I'm aging and things are falling apart, I started kind of working on him as a project when he was 4, and he's now 17 hands. And yeah, that's just, I'm a typical horse person and make so smart decisions, but
I bought
ride or die.
Yeah. No, we're on the same page because I bought my now 7-year-old as a 4-year-old right off the track, and he's now 17-1. And I was like, I did not want one this big, especially
I
one.
didn't either.
But he's a sweetheart. He's got a good brain. So,
And when you think about it, it's really only, 4 or 5 inches
yeah,
further to fall. And
yeah.
in the scheme of things,
At this point, I'll probably break something. Yeah.
yeah, really. So anyhow, those are my guys. And obviously with the 36-year-old, I have extensive experience on feeding older horses. Plus he has flaming PPID. So yeah, but we'll talk more about that in a bit. Because we're going to start with just laminitis in general. And this is what exactly is laminitis. And from the science and medical point of view, we know what laminitis is, but all the cascade of events that causes laminitis,
Right.
There's a lot there we do not know yet. So I'll start with just what it is. And so if you look at the anatomy of the foot, you've got the coffin bone down here in the foot. And it's also, it's the distal phalanx. And then you've got the navicular bone, little bitty dude right back here behind the coffin bone.
Right.
And then you have the laminae. And the laminae are these just little tissues that kind of interlock, and they go between the coffin bone and the hoof wall. So along the hoof, along the inside of the wall, you have these little tissues, and the sensitive laminae are along the outer layer of the coffin bone. And then the insensitive laminae they line there on the inside of the hoof wall. So you've got all these little folds of tissue from the coffin bone, and then they interlock with the hoof wall and hold the structures in place. Right. And again, the laminae that are along the coffin bone are very sensitive. There's a lot of nerve tissue there. So that's why when these little laminae become inflamed and try to separate, the sensitive laminae cause so much pain to the horse. And that's why laminitis in a horse is a very painful condition.
Right.
So laminitis actually occurs when the cells of the laminae don't get sufficient nutrients from the blood supply. And then they start deteriorating and separating. And so you can see on this bottom picture, you can actually, the hoof wall starts separating from the sensitive tissues underneath. So I have heard it described as if you think about taking your fingernail and pulling it away from the bed.
Right.
And then if your horse, because the hoof wall is basically your fingernail, so you take that, pull it away, and everybody can imagine how painful that is. But then imagine you've got 1,100 pounds standing on it.
Yeah. Like
Just
if you're doing a handstand on your nails and they're
on your fingers. Yeah.
Yeah.
And it's just,
so painful.
yeah, we get weenie about, just a hangnail. So think about these poor horses. So,
Yeah.
so, and just in general, laminitis is, and these are fairly old numbers, so it may have been updated, but about 15% of lameness cases are actually some level of laminitis. And of laminitis, about 7.5% of the cases are caused by a grain overload, and we'll talk a little bit about that. About 45% would be considered, grass founder, so caused by pasture grasses. And as I talk about, and there you notice with 45 and 7.5, there's still a pretty high percentage of laminitis cases, but I'll talk about in a moment about there are other things that also can cause. But in reality, the grain overload and the grass founder are kind of the same sort of situation. So, and I took this quote from the UC Davis Vet Med website, that laminitis is irreversible. Treatment is initiated to minimize further damage, and recovery outcomes vary widely from horse to horse. So really the big thing to me is recognizing horses that might be at risk. Then secondly, if you've got a horse that you think might be at risk, you've just got to be diligent about watching them and trying to catch any indications really early, because the earlier you can catch it and the veterinarian can treat it and remove the cause, the better chance you have of that horse actually recovering and being able to continue being, completely useful.
Right.
Once it's gotten to a specific point, then there's going to be some damage that is irreversible. And I will say, having been in the horse industry for a long time, there was a point that back in the past, basically laminitis, it just, wasn't a whole lot you could do. And now there are treatments, and farriers are also very important in working with horses that have been through laminitis, because I have seen horses that have developed laminitis, they get treated quickly and they come back, fully sound and go on. So saying laminitis is irreversible, yeah, it's irreversible, but if you catch it early enough, you can treat it and the horse can continue. And again, then you just have to really watch.
Yeah.
So stages of laminitis. So the earliest stage would be developmental, and this is when the lamini are just starting to become inflamed from whatever the reason, and the horse may not show clinical signs at that point. So that's when you really want to know your horse, be aware if your horse is at risk for laminitis, and just watch them like a hawk. So if you can catch it in the developmental phase, you've got a much better chance of being able to treat and minimize any damage.
Yeah.
The acute phase, you should be able to see that. And the acute phase can last hours to days. And so again, if your horse is showing signs, get your vet and you get the reason for the laminitis, remove the reason, so then you can treat it, and hopefully they can recover, and then work with your vet and your farrier. But the acute phase, you've got the first signs of lameness. And at some point in the acute phase, coffin bone rotation can occur. And that's what happens is when the sensitive lamini start separating and the inner structures are no longer stabilized within the hoof wall, pressure then on that coffin bone can actually cause the coffin bone. You can see in the picture here, the coffin bone has actually, you want that coffin bone to be at about the same angle as the hoof. And you can see this coffin bone has dropped down. So it is no longer at the same angle of the hoof. And if it can happen if the laminitis goes on without any kind of help for long enough, that coffin bone can rotate so far that it can actually pierce through the sole of the foot in severe cases.
Right. And Katie, tell us about, and when those first signs, is it always going to be in multiple feet? Can it happen in just one hoof, or is it probably going to be in multiple hoofs?
Part of that is a very good question, and it can happen in one foot. Kind of the times I have seen it happen in one foot is more a mechanical type of laminitis versus, and I'll talk about that in a bit, soluble carb overload to the gut. In those situations, we are usually going to see two or all four, because it's fairly common in laminitis to see both front feet affected. And if the laminitis is allowed to continue, then you can see all 4 feet. But in a mechanical laminitis, you can just see it may happen just in 1 foot.
Yeah. So being hyperfocused, I mean, in case if you are someone with a horse that is just displaying signs in 1 foot, and that's a good point too. Can it kind of start in 1 foot and then move over and be the front 2, from that?
And it may even be that you just notice in 1 foot, because to the horse, that foot is more sore.
Right.
And so, yeah, if they could just speak English and say,
Right.
my right foot really hurts, but my left foot hurts a little bit too.
Right.
But so the things to look for, you can see an increased digital pulse or pulses if it's multiple feet. You might see swelling down around that coffin joint or the coffin bone area. Sometimes you just see them shifting weight. If they're getting sore, they start kind of shifting around, trying to minimize the weight on the more sore feet. Right. Reluctance to move, lying down, they just don't want to get up. And then there's a classic, I think on my next slide, I have a picture of the classic stance where they're kind of hunkered back on their hind end because their front feet hurt. Mm-hmm. And then beyond acute, the laminitis can either move from acute to chronic, or sometimes it seems like it just goes from developmental to chronic and you don't really see the acute phase. But if you're seeing clinical signs for a week or longer, then you're in the chronic stage. And definitely in chronic, you can see the displacement of the coffin bone. If it goes on long enough, that's when you're going to see those growth rings, because when the blood supply is affected into the foot, then that's going to change the hoof growth from the coronary band. So you're going to see rings from how the growth has been affected. And again, the coffin bone can penetrate the sole in severe cases.
Yeah. And would you say the rings on the hooves, for me personally, any horse that I got later in their life, that's kind of one of the things when I would look at their hooves, and if I saw those rings, I would say, oh, they foundered, or, have laminitis prone issues, or, things like that. Is that kind of a good indicator?
It's an indication that there's been something.
Yeah.
Now, whether it's laminitis, certainly it could be just because I've seen it in just nutritional aspects. Mm-hmm. You've got a horse that the nutrition suddenly changed from poor to good or good to poor. Mm-hmm. And then the hooves, the nutrients for good hoof growth change. And so you can see a change then in the hoof growth. So I would look at those rings, and the big thing for me is something happened. And number one, I want the vet to check and see if laminitis is an issue. Or if, they may radiograph and say, nope, everything looks good. And then I say, okay, something else happened to them. And in that case, I may never know. But if their feet are healthy, then it's like, well, okay, then.
Yeah. So, just to let our audience know, if you're listening through our podcast, we are going to post these slides and images on our website, so you can go back and reference. But Katie's doing a great job kind of explaining these images, but I just wanted to let our audience know that as well. So go ahead.
Okay. And this, I have to say, this years and years, I thought laminitis and founder were the same thing. And then I was educated and I was going, oh, this makes so much sense. Laminitis versus founder. Laminitis is the condition. It is the disease. Founder is when the coffin bone rotates.
Okay.
And it is called founder because when a ship goes down, it's foundering. I was going,
Interesting.
oh, duh.
Yeah.
So, yeah. So that's why when that coffin bone rotates, it's like a ship going down. So this picture of the ship came from the Merriam-Webster dictionary. And it actually, I was Googling for images and the answer was, can a ship flounder? Well, no. and they were explaining the difference between founder, when the ship goes down and sinks, versus flounder.
Right.
So the answer there is no, pretty much ships don't flounder.
Yes.
We might flounder, but the ship does not. Okay, so symptoms of laminitis. This is a picture of that, the typical laminitis stance. Like you can see the horse is kind of trying to put all its weight on its hind end and getting the weight off of the front end. And I have actually in real life seen horses that have the laminitis is so bad, they just don't have a comfortable foot to stand on.
Yeah.
If a horse gets to that point, and especially if it's chronic laminitis, I hate to say this, but there are times the kindest thing to do is to let the horse go because they're never going to be sound again. But
yeah, and that's a good point. I think working close with your veterinarian when you have chronic cases and really determining the quality of life. You know, with my miniature horse that I had, it became a question of, and I had a great relationship with my veterinarian and I still do, but I told her too, if you're looking at this situation, you need, and I'm not seeing it because I'm too close, you need to tell me the quality of life. So always having those conversations with your veterinarian, quality of life.
Yeah.
That is the best thing you can do as an owner for your horse, especially in this painful situation. Yeah.
Yeah. So the clinical signs, the amount of damage is going to affect the amount of lameness. So the more damage, the more sore the horse is going to be. And then that doesn't mean if you have a horse that's really sore that you can't, with your vet, work on treatment and corrective shoeing with your farrier and help get them back to where they are comfortable. So not, it's certainly depending on the horse. I have seen some really good outcomes with laminitic horses. The lameness, as we talked about, can be variable, severity in one or more hooves. So it can be one, can be two, can be all four. Can't say I've ever seen three, but
it could happen. You're right.
It could happen. And how can you tell? Oh, okay, that's the one good leg. So.
Right.
But another thing is the weight shifting, trying to get the weight off a sore foot in this characteristic stance. And sometimes really, really early, you might just notice just a little bit of ouchiness and just in the front. And I've had students that their horses, they bring their horse out. I'm going, they're just a little bit ouchy. Need to check that. So it's really nice if the farrier had been there the day before and you go, oh, they just got a little bit short.
Yeah.
I like that ouchiness.
Yeah.
But it's something to, again, if your horse is at risk, just be aware. And then the pain responses, looking for pain responses, elevated respiration and heart rate, and just the indications that your horse is showing some pain that you might not really notice otherwise.
Absolutely.
Okay, so the causes. Our topic is kind of fall laminitis, but so I wanted to just put pretty much all the causes of laminitis to start with. Number one is the overload of soluble carbs to the hindgut. And this is the classic horse got into the feed room type of situation and ate a bunch of feed, got a bunch of sugar and starch into the hindgut. Got a slide to explain kind of why that happens. but that's kind of the grain laminitis.
Mm.
That also, though, is, the pasture laminitis is really a very similar thing.
Mhm.
You can either have the starch and sugar from grains overloading and getting into the hind gut, but pasture also at certain times can be very high in storage forms of soluble carbs. Some warm season pasture grasses tend to store their sugars as starch, and those grasses are less likely to cause laminitis. But cool season grasses will store their sugars as a non-structural carb called fructan. And the plant can store enough fructans that the horse can kind of overgraze and get those fructans, and they can overload the upper gut into the hind gut. And also that's more the pasture laminitis or founder. And the times we have the most risk are in spring, when we get that nice lush green grass, and then in the fall when environmental conditions are correct. Like right now, I'm in Kansas and we are so dry. We're dry, 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 dry. And if we suddenly start getting rain before it gets cold, pasture's all coming back, and that's when it's going to be at risk.
Right.
So, some other causes would be metabolic conditions like equine metabolic syndrome, insulin dysregulation that can go along with metabolic syndrome or kind of be an issue on its own. And then pituitary pars intermediate dysfunction, PPID, which is commonly known as Cushing's disease, but the correct name now is PPID. I will say, though, with the PPID horses, because as I said, my old guy is got flaming PPID. He would have a mammoth woolly hair coat. He would have it now. He does not shed, so I manage it. But he's been body clipped 3 times.
Yeah.
And spring, summer, fall body clipping, and now I'm letting his hair grow back because it should be about timing that when it gets cold, he will be completely covered with 2-inch long hair.
We'll be ready.
Well, yeah, he will be ready. I am very lucky.
It gets that curly kind of
Yeah.
too, right? Yeah.
Yes, and Kansas in July, you don't want your horse having 2 to 3 inch long hair, and he would.
Right.
Now I am very lucky though, because with the PPID, he does not have insulin dysregulation. I am knocking on wood. Because it's estimated about 30% of PPID horses also suffer from insulin dysregulation. Mm. And there is a theory, Dr. Diane McFarlane has done a lot of research on metabolic horses and PPID horses. And her theory, last time I heard her talk, was that at some point somebody's going to find the connection that possibly the PPID horses that do have problems with insulin resistance and are prone to laminitis are horses that were undiagnosed with metabolic syndrome before the PPID, which makes a lot of sense to me. Again, I've got this old guy with all this hair and he's out on pasture. Now it's going to be
and that's a good point. I've heard some theories too that, and not always, not in all horses, but metabolic conditions can be a precursor to PPID as it kind of escalates. Is that kind of the same idea, or it's just,
yeah, I'm not sure that they're going to really figure out that relationship. I don't think that necessarily is a cause and effect.
Yeah. Right.
Because I had a 14-year-old thoroughbred mare that was diagnosed with PPID at age 14, and her only symptom was a friend was trying to breed her, and she spent an entire summer with the stallion and never settled.
Right.
And that was the only symptom. But then she was tested and she did have PPID, and she passed soon after that, because PPID it's a brain tumor.
Right.
So I don't know that that there's a cause and effect between the metabolic issues and the pituitary tumor. So that again, no, Livy.
We have a guest.
Murderers, thieves. Okay, this is when I have liver treats sitting right next to me, so I can say, okay, Livy, get distracted now by a liver treat. Thieves and murderers are not coming to kill me. It's nice to be protected.
Yes.
So again, there's so much to still learn about, what's going on. And I will say, 15, 20 years ago, the only way you could even diagnose PPID was on necropsy. So we know a lot more about it now than we did, but we still have a lot to learn. There's so much we don't know about metabolic syndrome.
Right.
But yeah, there's plenty of fodder here for research for the next centuries.
Yes.
So anyhow, but we're talking about fall laminitis. These are the metabolic conditions and the soluble carbs in the hindgut. Those are the things that in the fall we cause our horses to be more at risk. But other causes of laminitis would be ingestion of toxic plants and black walnut shavings. And I think in general, horse people I have talked to know that they shouldn't use walnut shavings.
Right.
And this is why, because black walnut wood causes laminitis in horses. So anytime, don't ever use black walnut shavings to bed your horses. And it's funny because anymore I don't hear this talked about nearly as much because everybody's into the endocrine issues, the trauma. Growing up, I heard a lot about road founder.
Right. Yeah.
And that's just concussion, and the concussion on the foot can cause the sensitive laminite to separate. So you got the same sort of issue having nothing to do with feed, soluble carbs, digestion. It's just the trauma. And you see that work on hard surfaces. You can also see it on compensatory weight bearing, because if I remember correctly, was it Barbaro, the racehorse?
Yes.
That had a fracture and was recovering well from the fracture, and then they ended up having to put him down due to laminitis. Right. I believe it was because compensatory weight bearing, putting all the weight on the good side and then causing laminitis. Absolutely. So something, if you've got a horse that is having a big lameness issue on one side, make sure you take care of the good side too, and support it and
and watch closely. Yeah.
Yep. Okay, so fall laminitis, so in particular, that overload of soluble carbs to the hindgut, whether it's, hopefully it's not going to be because of what you're feeding him. Hopefully you're feeding appropriately year round, but if your horse gets into the feed room in the fall, you can then have
lines up. Yeah.
But really, it's going to be changes in the pasture carbs, and back to that discussion of fructans.
Yeah.
And then if your horse is suffering from a metabolic condition, as environmental conditions and dietary components change, whether that's pasture, or sometimes people may be saying, we're going to go into the winter, so let's up the feed and put some weight on them going into the winter. Got to be careful about doing that too, because that might trigger laminitis episodes. So again, horse with metabolic syndrome, insulin dysregulation, or PPID, again, watch them through these times of year.
And Katie, tell us, for horse, maybe undiagnosed horse, there's been a lot of discussion too, especially in performance horses, that, the plumper, the better for the show ring. But in a metabolic case, tell us some visual signs, like classic, if they're not diagnosed, but you're noticing, oh, I've got my pony's fat, or things like that. What are the classic signs?
You're ahead of me.
Oh, okay. I'm jumping ahead.
I have some slides.
Perfect.
So before I get there, though, I want to
Yeah.
kind of try to explain why that overload to the hindgut happens, whether it is from grain or from the fructans, non-structural carbs in the grasses. And it's because of the horse's digestive system. And because I could go and eat an entire package of Oreos and not develop laminitis.
Right.
So, which now I want to go eat an entire package of
All right.
Oreos. Not do that.
Correct.
It's because the horse has a weird digestive system. So this is just a little schematic that compares the horse to the dog and the cow. And you can see it looking through, here's the cow's stomach, the horse's stomach, the dog's stomach. The cow is a monogastric, and it's a compartmented stomach. And the biggest compartment that makes most of the cow's stomach is the rumen. And the rumen is actually a big microbial vat. So you feed a cow, the feed goes into the rumen, and the microbes actually digest the feed. So it's not typical digestion that we're familiar with, with ourselves or dogs and cats. In the ruminant, it's microbial fermentation. And you can see here the horse's stomach looks a whole lot like the dog's stomach, and they function the same way. They're monogastrics, and we are too. So in the horse's stomach, there's digestive enzymes and hydrochloric acid, and that's what breaks down all the food.
Right.
And then from the stomach, you got the small intestine that's the same kind of in all of the critters, and that's where the majority of nutrient digestion and absorption take place. So most of the foodstuffs that are broken down in the small intestine and the nutrients like the amino acids from protein and a lot of the sugar from the starch and sugar in the diet are absorbed in the small intestine.
Right.
And then you get to the cecum, and you can see the cow just has a very small cecum, and the horse has this huge cecum, and the dog has this little wormy looking thing that pretty much does nothing.
Right.
But in the horse, that cecum, that is where the microbial fermentation takes place. So in the cow, you've got the fermentation in the stomach, and in the horse, it's at the back end of the small intestine. So that's where microbial fermentation. There are billions of bacteria, protozoa, actually even some viruses live back in this cecum. So any feed that makes it undigested and absorbed from the small intestine gets into the cecum, and then the microbes work on it. And the importance of that for the horse is that's why the horse is able to utilize grass and hay.
Okay.
Because we can't. We eat fiber to keep us regular. It
Right.
pretty much passes on through. But we all know there are lots of horses that maintain perfectly appropriate body weight and body condition just on pasture or hay. And that is because the microbes in the cecum can actually ferment, digest all that fiber.
Got it.
Mammals don't make the enzymes themselves to digest, to break down fiber. So microbes make those enzymes. The horse has the microbes in the cecum. So that's why they can utilize the fiber. The tricky thing is we have to keep, there's a lot of information now about prebiotics, probiotics, now postbiotics, all these things. There are, I swear, thousands of supplements that you can get to help support the microbiome.
Right.
That's the bugs in the hindgut. You got to keep the bugs in the hindgut happy to have a happy and healthy horse.
Yeah.
And that's why grain overload or pasture non-structural carb overload causes problems. Because in general, we want sugar and starch to be broken down into sugar, glucose, in the small intestine, then it's absorbed into the bloodstream. And insulin then comes from the pancreas to help push the sugar from the bloodstream into the cells where it's going to be stored or used.
Right. Okay.
But if you get a whole bunch of sugar and starch or fructans that are not digested and absorbed in the small intestine, they flow into the hindgut, and that messes up the bugs because the microbes are not used to having a bunch of soluble carbs. And that it ends up, now this is just kind of talking about the difference in the microbial fermentation. Here you see overflow of starches and sugars into the microbes can result in colic and or laminitis.
Got it.
And so that's the sugar and starch from an overload of grain,
Mhm.
or the fructans are tricky because fructans are kind of like a fiber that we don't have the enzymes to break them down. The mammals don't.
Right.
But when they do get into the hindgut, especially a sudden big load of them, the microbes can ferment them, but they actually ferment them very similarly to starch and sugar.
Right.
So when that happens, you get, let's see, sugars, starches, and especially fructans can bypass digestion in the small intestine, reach the hindgut. The availability of those soluble carbs allows increased population of lactate-producing gram-negative bacteria that rapidly ferment the carbs. Byproduct of this fermentation, and this is not normal fiber fermentation, this is the non-structural carb fermentation. So they produce lactic acid that drops the pH and the hindgut becomes more acidic. That decrease in pH then starts killing off the normal fiber digesting bacteria. And as they die, they release endotoxins, reactive amines, and exotoxins. That just sounds horrible, doesn't it?
Yeah. It's like a cascade of.
It is just a cascade of nastiness. And so these compounds are thought to adversely affect circulation, increase inflammation, and destroy lamellar basement membranes in the hooves, causing laminitis. Now, what is happening between the hindgut and the hooves?
Right.
We don't know exactly that pathway.
How it gets.
Yeah. How all these nastiness things in the hindgut are getting, what the cascade of events, the endocrinology, et cetera, what that's doing to the feet. But
yeah, and I feel like people or horse owners in general, and let's not necessarily on the grass, but let's say the horses get into the feed room, me immediately, colic. That's immediately what I'm going to be thinking of. Can there be an episode of experiencing both in a really extreme case? Yeah. So being on the lookout for both.
That's the worst case scenario.
Yeah. Worst case scenario. Yeah.
So now you got a horse whose belly hurts and the feet hurt. Okay, so that's the overload of soluble carbs into the hindgut.
Yeah.
The other issue, which is kind of a different type, again, these are not all well understood, but the insulin dysregulation. So I mentioned that when the sugars are absorbed from the small intestine,
right?
So you see a rise in blood glucose, just blood sugar, and then that stimulates the pancreas to release the hormone insulin, which helps push the glucose out of the blood into the cells. In a situation of insulin dysregulation, something goes wrong in that pathway. And so the insulin is either not released, or it more usually is released, but it is not successful in helping to get the glucose out of the bloodstream. And so you see increased glucose in the bloodstream, and then you see the pancreas releasing more and more insulin to try and get the glucose down. And so that, again, it can trigger the hyperinsulinemia, triggers alterations in blood flow to the hooves. It happens, we're not exactly sure why, but that boosts the expression of the lamella pro-inflammatory cytokines that activate inflammation and alters glucose metabolism within the hoof lamellae, causing laminitis.
Got it.
So 2 different modes of action.
Yeah, completely different.
Yeah, but and that's what when somebody gets hold of me and says, okay, I have a horse with laminitis, how do I feed it? I'm going, okay, what's causing the laminitis? Because if it's an overload of soluble carbs to the hindgut, I may go one direction. If it's because they have insulin dysregulation, I'm probably going to go a different direction. So, okay, now to answer to your question.
Yeah.
Individual horse risk. How do I tell if my horse is one of those at risk? I will say obesity is an enemy. Now, not all obese horses are going to be prone to laminitis. But in general, obesity is not healthy, and fat tissue is not inactive tissue.
Mhm.
And fat tissue itself helps increase the risk of laminitis. So it's there are hormones involved, the endocrine system. So just in general, horses are not designed to be obese animals. They're designed to be, fairly leanish, active individuals. And there is research that shows that just exercising a horse, keeping a horse more active, will help increase insulin sensitivity.
Right.
And having an obese horse lose weight helps increase insulin sensitivity.
Right.
But so the horses that are prone to obesity are going to be the ones that I'm going to first be vigilant about watching out for laminitis. And so you want to be sure you're familiar with body condition scoring and keep track of your horse's body condition score. And if we also know there are breeds that are more prone to laminitis, the pony breeds. So the easy keeper breeds often are more prone to laminitis. So ponies, quarter horses, Morgans, you don't see it too much in thoroughbreds. Warm bloods, draft horses, those are the typical easy keeper breeds.
What
So
about, yeah, what about Arabians? Because I had some experience in college when I worked for a vet and I was feeding an Arabian show barn. And at that barn and then at another barn where there was an Arabian, they had issues with laminitis and founder. And, you think about Arabians, they're not traditionally the overweight breeds. They are more refined, lean breeds. But what about, in those instances of, oh, just because my horse is lean, they're probably okay.
And you can have a horse with metabolic syndrome that is not obese.
Right.
And Arabs do, I've seen quite a few metabolic Arabs.
Mm-hmm.
And with the Arabs, in my experience, they tend to exhibit more of the regional adiposity, that they have patches of fat.
Yeah.
So, but yeah, they're again, the ones that you don't see the issue as much are thoroughbreds, and then the breeds that have a lot of thoroughbred in them.
Yeah.
So
Well, I'm also a thoroughbred owner, and I feel like I watch out for everything except for founder.
yes.
Knock on wood. That's not.
Yes.
Yeah.
Yeah. Oh, yeah. I have several clients with thoroughbreds, so
Yeah.
yeah.
They're
But
their own case of nutrition
they are.
management.
They have developed all their own risk factors.
Yeah. Yes. Okay.
So, but so if you've got a horse that is prone to metabolic syndrome or just obesity, watch them, make sure you keep them at a good body condition score. If a horse has had a previous episode of seasonal colic and or laminitis, then they're probably going to be higher risk. So you want to watch them like a hawk. And then, of course, watch any current signs of discomfort, lameness, etc. And continue to evaluate throughout seasons of fresh pasture. Again, it's usually a big problem in the spring. It's another big problem during the fall. And the other thing that people often don't realize is these cool season grasses, when they are stressed, they get stressed like during during drought. These grasses, that if they are missing one of the elements to grow, which would include water, they may still photosynthesize during the day and synthesize sugars, but then they can't grow, because that's what they do. They photosynthesize during the day and they make all the sugar. And then at night, plants grow at night, and they're using their sugar to fuel the growth. But if something is missing during their growth period and they're not using the sugars, then they store the sugars. And as I said, cool season grasses store their sugars as fructans. So when the grasses are stressed due to drought, temperature, whatever, some of these suckers can store a lot of fructans, and you're going, it's brown, it's not a problem. And then you got horses at risk that start showing signs of laminitis.
I'll be right back. I'm going to go put my Mustang up now. No.
Okay. So you just keep an eye on your pasture, understand the risks, watch for digestive discomfort, foot soreness, and watch for changes to body condition score. Because if your horse is starting to really put on some weight, it's like, that's increasing the risk. You got a choice, diet and or exercise.
Yeah.
I would love if there was a magic way to lose weight, I would be a size 2. I'm
Yes.
not. There's nothing magic. I like my Oreos. So,
Right.
and life is short. You should eat the Oreo.
Yes.
But
I agree.
so again, you want to be familiar with the Henneke scoring system, which body condition score 1 to 9. 1 is poor, 9 is extremely fat. In general, you want to keep the horses at about a 5. If you've got a horse that's had problems with laminitis, you might want to keep them more at a 4.5. So you might just barely be able to see the ribs, because in that case, you don't want them to be fat and have metabolic problems. But the other thing to think about, a horse that has compromised feet from previous laminitis, you don't want them carrying a lot of excess weight, because that's just more stress on the feet.
Right.
So 4.5, 5 at the max for those horses.
Does age play a factor in some of these really easy keeper horses?
It's a very good question. And yes, but it can go both ways.
Right.
Boo, my old guy, was an incredibly easy keeper and he was fine on pasture or hay and ration balancer and regular exercise. That kept him right at about a 5, 5.5.
Yeah.
And then when he was about 25, he went from being a really easy keeper to a harder keeper.
Right.
And I started really graining him high calorie feed. He would be getting about 6 pounds a day.
Right.
He was still fine. In the summer on green grass, he would still be an easy keeper. And in the winter, I'd go back to the feed. And then when he was about 29 or 30, he became a really hard keeper.
Yeah.
And now at 36, his teeth, if Boo bit you, you would laugh, because his incisors are, his gum line. He's still eating. Well, he's still chewing on his hay and he's not choking or anything, but he's now, he's getting about 14 to 15 pounds a day of, his senior mixture that he's also become a really picky eater. So I have to make him things that he's really happy to eat, but I'm keeping him at about a body condition score 5 to 6.
Yeah.
So knock on wood again, he's not been prone to laminitis, but if he was, I would be having to adjust to maintain an appropriate body weight and probably be looking at the total soluble carbs that are in his, feed, to make sure I'm never taking a chance of overloading the hindgut.
Right. Does age play a factor in some of these common conditions that can trigger laminitis, like metabolic syndrome and PPID?
PPID that tends to be an issue with older horses. So in that regard, yes.
Yeah.
As far as metabolic syndrome, if they've got metabolic syndrome, I don't know if it's so much age related, other than age makes it trickier to manage.
Right. That makes sense.
So, because and two, you think about things that go along with age, like arthritis and just discomfort. And so you got a horse, especially one that has had laminitis, then they're aging and they've got some arthritis going on. You get to the point where you're having to look at taking exercise out of the picture.
Right.
So you're not being able to maintain appropriate body condition with exercise. So then you really have to be vigilant about the diet.
Yeah, on the diet. That's what I was going to ask with if you have a senior horse that's displaying these signs and laminitic prone, but then they're also stiff and they're joint, there maybe some arthritis is going on and they're out of work if they have been retired. If, general hand walking is, simple things like that.
That's going to help.
Yeah.
Yeah. Any activity is going to be helpful in Again, as I said, the exercise does help make the horse more insulin sensitive.
Right.
And so they're designed to be active animals. So the more sedentary they are, the more at risk they're going to be for all sorts of metabolic issues.
Not so different from us. You think about insulin resistance, and the number one thing that doctors tell people is exercise, make sure you're eating a diet that's lower in sugars and starches, and exercise, it's that kind of parallel. But again, we don't develop that painful, where our nails separate from our fingers. So,
and I don't know how many, my farrier and I work with several different vets, and they all say, one of the reasons Boo is still doing so well at 36 is because he still has a job.
Yeah.
And as long as Boo is capable of having a job and wants a job, Boo's going to have a job because it's certainly healthy for him. Absolutely. So knock on wood.
Yes.
Boo is, there's going to be an apocalypse, and the only survivors are going to be the cockroaches and Boo.
Boo. That's impressive. He's an anomaly for,
and he's going to be saying, "Where's my mom with my food?"
Yeah, exactly.
So this is a body condition scoring chart that's on the KER website. If you're not familiar with body condition scoring, this is a very valuable tool to help you with the health of your horse.
Perfect.
And this is Klinger, the Haflinger, that I had as a lesson pony for several years. And he's absolutely an at-risk horse. He's a Haflinger. He's an easy keeper. And I've got him at a pretty good body condition score in this picture, but you see, he's still got that big crusty neck, which is, a risk factor. But that's the thing with the metabolic horses is when you body condition score him, I would look at his neck and say, that's a body condition score of 8. Mm-hmm. But then I feel over his ribs, and his ribs are just covered. So if I tried to take off more fat, it wouldn't come off his crest. His ribs would be hanging out. So that you have to just kind of know body condition scoring and adjust it to make sure you try to keep your horse at an appropriate body condition. And then again, keep an eye on the environment, pasture condition, use grazing muzzles if appropriate. Klinger had a grazing muzzle on 24/7, except when he was ridden, even though he lived in a dry lot with a round bale. He had to have a grazing muzzle for the round bale.
Right.
Yeah. So dry lot if needed. And then feeding the high risk or post-laminitic horses. And this is a horrible picture. This is a coffin bone. It's rotated so much, it's through the sole. I believe these days, even this far gone, there has been some success between veterinarians and farriers to bring these horses back to, being comfortable. So, 20 years ago, this would have been done.
Yeah.
But to feed them, you want to look for lower soluble carb, which again, starch and sugar feeds. Mm-hmm. Beware of the soluble carb intake per meal, because there are people who just get so hung up with, I need to have a feed that has less than 10% non-structural carbs. No, you don't have to be that vigilant. Just like with Boo, who gets huge amounts of feed because he's really getting nothing out of his hay, then if he was insulin resistant, I would really be aware of how many grams of soluble carbs he was getting per meal, so as not to overload the hindgut or to just manage the blood glucose insulin response. And so in these situations, to know how much is in your feed, and then, to some extent, you got to make sure your horse is going to eat the feed. You get some of these really low starch feeds and they're not very palatable. So you might go with something, 12 to 15% NSC, and you're still going to be fine. And you feed in smaller meals spread through the day, so you don't get these big amounts of glucose.
Right. That makes sense.
And then again, a body condition score more like a 4.5 to keep the weight.
Yeah.
And this is just to kind of look at the starch limit per meal. So if you've got if you look at the small letters down here, to reduce risk of exacerbation of insulin resistance, the recommendation is limit starch intake to less than or equal 0.3 grams per kilogram body weight per meal. This is a horse that is really, really high risk. That when you're, a typical horse that you're just looking for, kind of low non-structural carbs, you're going to be in this 2 grams per kilogram body weight per meal, because that's where you want to be to reduce the risk of an overload, so starch and sugar getting into the hindgut. But if you have a really significantly insulin resistant horse, go back, then we're down to this 0.3 grams per kilogram body weight per meal. So just looking at the amount of NSC in the feed versus oats versus rice bran, and I put rice bran because a lot of people are kind of big on rice bran, and rice bran is really, it's got quite a bit of soluble carbs.
Yeah.
Oats is 50% non-structural carbs. So to just reduce risk of hindgut soluble carbs, you can feed about 5 pounds of oats to a 1,000-pound horse in a meal. But if you've got a really insulin resistant horse, you're all the way over here to only 0.7 pounds of oats.
Right.
Because oats are pretty high starch.
Yeah.
But if you've got a feed, a 15% NSC, which is considered low starch, 15%, you can feed 15 pounds without worrying about starch getting in the hindgut. But for a very insulin resistant high risk horse, you're looking at about 2.2 pounds of that feed. So it depends on the risk factor of the horse. But people get so hung up. And if you look up at the 35% NSC in the feed, which there are people who go, oh my Lord, your horse is going to explode with that much. That's moderate. That's not, as for a feed now, it's considered high starch, but still, just to minimize risk of overload, you could still feed 7 pounds of it in a meal. Yeah. And then highly insulin resistant, you'd only want to feed about 1 pound.
Right.
So it just depends on your horse and your horse's risk factor.
Right.
But I get really frustrated with people, like barrel racing horses do fine on a sweet feed.
Yeah.
They're athletic, they exercise. You rarely find a really fat barrel racer.
Right.
And the soluble carbs in the diet are good for that explosive energy. Racehorses eat lots of soluble carbs.
Yeah.
So just keep your horse at a good body condition score, keep them athletic, and then you don't have to, get too horribly wild about worrying about soluble carbs.
Is this a little, thinking about the horse that's highly, highly sensitive versus the moderate horse, is that kind of trial and error as you're figuring out with your horse that's showing signs or develops a laminitis episode and founder?
That is a really, really good question. And quite honestly, if you've got a horse in any phase of laminitis, I would say, okay, let's start with low. Yeah. Let's be really, really conservative. And let's go with, like a 15%. Or quite honestly, you get below 10% in a feed and I get scared because the horse needs some soluble carbs to function. They need the glucose as a fuel. But so I would go, 15% or below on the feed. And then really make sure you're looking at the forages, because like if your horse is on hay, you can always soak the hay. Yeah. And because it's soluble. So the soluble carbs are soluble in water. And so if you soak your hay, minimum of 30 minutes in hot water or 60 minutes in cold water. And then so you soak it like in a muck bucket, and then you pour the water off. And then you give them the wet hay. You've gotten rid of up to about 30% of the soluble carbs. Right. If you use, and think about what type of hay you're feeding, because the warm season grass hays are going to tend to be lower in soluble carbs to start with. Right. Right. So look at your forages. If they're currently going through laminitis, you're going to get them off green grass. Just totally. And probably.
Yeah. What about dehydrated hays and hay pellets? And can those be useful for, laminitis prone horses?
You know, it depends, because like the hay pellets, depending on what type of grass or legume,
Right.
they may, or because just in the pelleting, they're not going to lose any of the soluble carbs.
Yeah.
So I would say now you can get products that have been tested.
Mhm.
And
Mhm.
like if you can find like teff hay or teff hay pellets, that teff is a warm season grass. So it's going to be low in soluble carbs. So
Right.
that would be something that you could use. Coastal Bermuda grass is a warm season. My part of the country, Kansas, about the only warm season grass we really have access to is prairie grass.
Mhm.
And to some extent, that's going to be a trial and error of can your horse tolerate
Yeah.
the pellets or the hay?
Right.
And if they still get ouchy, then soak. And yeah, it's you whatever forage you're using, you can have it tested and look for
Yeah.
NSC. And when you're testing the hay, what you're going to be looking for is starch and water soluble carbs or ethanol soluble carbs.
Right.
And so NSC is kind of defined as starch plus water soluble carbs.
Okay.
But if your horse is insulin resistant, then I really look at starch and ethanol soluble carbs and add those together. And for that, I'll be looking at a hay that tests at like 10% or less.
Got it.
And when I was talking about a feed that's 15%, you're
Mhm.
feeding so much less of that that
Right.
they're not getting a lot of grams of starch and sugar. But if you're feeding 20 pounds of hay, then you do want to be looking at, for
Love.
a real, the 10% or less. You can get way less than 10%, but that tends to be really trashy hay and your horse is going to get no nutrition out of it.
Yeah.
So you have to kind of balance that.
Yeah. That makes
And the
sense.
other thing, if you are trying, if you're dealing with a horse, one of the things a lot of vets will first do is take your horse off all grains.
Yeah.
And just put them on hay. And the thing is, there are nutrients that are not in the forages that the horse still needs to be healthy. So when the vet says, get your horse off grain, I'll say, okay, let's at least come in with some ration balancer.
Right.
And make sure the horse is getting all the nutrients that they need. And when I was at Purina, we actually ran some research on looking at the glucose insulin response to a 1 pound meal of ration balancer.
Yeah.
And there was almost no glucose insulin response.
Wow.
And that ration balancer averaged about 13% NSC. And so you could feed a pound and it was not increasing the risk.
Yeah.
So
Definitely.
and then just some supplements. I am here on behalf of Kentucky Equine Research, and KER has some amazing supplements that can be very helpful. And I got to say, I am a huge fan of the KER Equisure supplement because that is a buffer for the hindgut.
Awesome.
And it's an encapsulated buffer, so it actually gets to the hindgut, which is, it's hard to get anything through the stomach and small intestine and arrive intact at the hindgut. But
Right.
Equisure does. It's got some great research on how it affects the pH in the hindgut. And so when you are in situations where you've got a horse at risk of the hindgut acidosis from lush pasture,
Yeah.
the Equisure will help keep the pH of the hindgut much more stable so it doesn't affect the microbial population. So when you're in high risk environmental situations, then the recommendation is 2 to 3 times a day.
Right.
But any horse that I have that's at risk, and the younger horse I work with is one that I keep him on Equisure just to maintain that stable hindgut. And this is not research based at all. This is personal experience based. It also seems to keep him it reduces the highs and lows in his personality.
Oh.
And I think it's just keeping his hindgut happy, and a happy hindgut is a happy horse. So
Yeah.
I'm a huge fan of the Equisure. And then the KER right track is kind of cool because it has EquiSure in it, but it also has buffers for the stomach. So if
Yeah.
you've got a horse that's also at risk of gastric ulcers,
Yeah.
you can buffer the stomach and buffer the hind gut.
Nice.
So two
Yeah.
pretty cool supplements.
Yeah. I think majority of horse owners would probably agree, not research based, but just off of opinion, that if the horse's tummy is not in a good place, their attitude isn't either. You know, like they talk about the sour horse, the ears back, dull, you know, and a lot of times it goes back to what's going on in the hind gut and
Absolutely.
so yeah, no, these are great.
So just take home messages. Fall pasture, think of increased risk of digestive disturbances. Be aware of your horse's pasture condition and your individual horse risks. And then recognize the changes in forages, manage to minimize the risk of digestive disturbances. You may, if you have a high-risk horse, restrict or eliminate access to fresh pasture. Use a grazing muzzle if you need to. I am a big fan of grazing muzzles. I know they hate them, but they do get used to them. And at least for a lot.
Yeah, they get to be out. At
Yeah,
least locked up.
exactly.
They get to be out. Yeah.
I think, and actually, when Boo first really developed the PPID, he was getting a little bit foot sore on the Green Spring pasture, and I was going, PPID, insulin resistant. So he and his best friend, a Palomino app, started spending the summers in, it's a pretty big dry lot, but it was a dry lot. And then when the pasture would really, after a couple hard freezes, they'd get to go back. Right. And then when Boo was 35, I said, you know what? I'm not going to do that to him. And I'm just going to let him be in the green pasture. And if because of the PPID he develops laminitis, I'm going to say, Boo, you have had a wonderful run. I'm going to give you a graceful goodbye. Yeah. And Boo said, hold my beer and watch this.
I'm making it to 40. Yeah.
Yeah. And so, and it was just me. I thought it was going to be a risk, and it's not. He's not got insulin dysregulation. So he's been fine now, knocking on wood again. He's had 2 complete years now on pasture. And so, but if it was a problem, I would start, can always go to a grazing muzzle. And like I said, I'm not going to put him in a dry lot anymore because he's such a happy boy.
Yeah.
Okay. Appropriate supplementation to address the pH changes and reduce the risk of hindgut acidosis. Provide nutrients that may be lacking in pasture at winnie forages. So again, big fan of ration balancers. If nothing else, a vitamin mineral supplement to make sure that the thing with vitamin mineral supplements is they're missing out on the amino acids because it doesn't have the protein. Right. So I'm big fan of balancers.
Yeah.
And then laminitis in horses is not completely understood. So we just managed to reduce risk factors with weight control and dietary management. Work with your veterinarian to determine causes and treatments for laminitic horses. Work with your farrier. If your farrier and veterinarian have a relationship, that is even better because corrective shoeing can help manage horses that have recovered from laminitis. And our website is really easy, KER.com. For additional nutritional help, we're more than happy to, help you out and make suggestions.
Yeah, no, this has been great. And for me, who's had a horse that foundered in the fall time and now having a horse that is showing physical signs of maybe a metabolic issue coming on and watching them like a hawk. But I think it's just a good reminder to all horse owners. And also, just talking about one shoe doesn't fit all. Sometimes it is trial and error between, one thing may work really well for one horse and not work at all for the other. So understanding your own personal horses and, and really their sensitivity to a lot of different things. I do have a question about just like the pasture in general. With fall grass, does the length of the grass matter in this case? Some people are the thought process keeping it cut short. It has more sugar towards the stem, so let it grow longer, so it kind of disperses a little bit more. Is there really any correlation with that, or is it just really about total consumption of grass as a whole?
Well, it depends on the type of grass and where they store their starch or fructans.
Yeah.
And from my understanding, the cool season grasses that store fructans, they tend to store the fructans at the base.
Okay.
But so the cutting doesn't really necessarily have much of an effect.
Yeah.
But it may have an effect on the growth, because if you cut it, it's going to be more likely to grow if the conditions are appropriate.
Yeah.
The warm season grasses that store their sugars as starch, I believe they store it more throughout the plant.
Mm-hmm.
But again, I don't know that cutting is really going to. It's again, it's more about the growth, and are they using their sugars, or are they storing them?
Right.
So
Yeah. Which goes back to drought, increase of rain, the temperature,
yep.
all of that in the fall time, the back and forth between, we woke up to 60 degrees here in Tennessee, but next week we may wake up to 90. It's just that constant.
Well, and yes, and that actually, I'm glad you said that, because that little light bulb. The other thing I should mention is that, especially cool season grasses, one of the reasons that the fall is so tricky is because the growth is more temperature dependent than
Right.
photosynthesis.
Right.
And so the cool season grasses can actually photosynthesize when it's pretty darn cold.
Yeah.
And so some of them actually, they can be covered by a thin layer of snow and still be making sugar, but
Right.
then they're not going to grow at night. And so for any of the grasses, when we have these really warm, sunny days and they're going to town making sugar,
Mm-hmm.
and then it gets chilly at night, and since growth is more temperature dependent, they're not growing.
Right.
So that's really the time when we have warm, sunny, lovely days and cool nights.
Yeah.
Boy, watch your horses like a hawk, because that's high risk for NSC in the grass.
Absolutely. And one other question, because we talked a little bit about just the imbalance of the hind gut, and it can cause so many different other problems from a gastro perspective. But if you have to pull your horse off of grass because they are starting to display signs of tenderfoot, how long can you limit them without any forage, if you do have to confine them to a stall or dry lot?
You got to keep the forage going. You really can't ever. So you've got to come in with some sort of hay or hay stretcher, some sort of forage replacement, because that hind gut has got to have the fiber to stay healthy.
Okay.
So that's when you're going to look at, and some of the forage replacements, like beet pulp, I wouldn't completely replace hay with beet pulp, but beet pulp is it's quite low in soluble carbs. Especially in that situation, make sure you get the non-molassed beet pulp, because beet pulp with molasses is going to have more soluble carbs. There are hay stretcher products that are basically one of the formulas that I put together has it's got some alfalfa, it's got some soy hulls, and other fiber. So it's beet pulp that are fiber sources that are not hay. Or again, they're I think Stanley makes some, I believe they make some hay pellets that have been tested and have starch and sugar possibly guaranteed. And I think some of the feed companies make forage replacements that have sugar starch guarantees. There are some chaff hays that are like maybe a combination of grasses that have maximums for the starch and sugars. But yeah, that kind of thing to replace the forage in the diet. You got to have the fiber somehow, but
yeah, absolutely. Well, yeah, I think that's, some people, some theories go with get them off the grass, get them on a dry lot. And we say that, but then at the same time, remembering horses have to have that constant flow of forage. So what does that
Yep.
look like when you do pull
Yep.
them off of the sugar grass? So I definitely
Yep.
wanted to touch base on that.
I'm glad you did, because yes, the microbes need the fiber.
Yeah.
And the forage is providing the fiber for the microbes. So you take them off the grass and you still have to provide the forage for the microbes.
Yeah. And again, going back to, there's tons of supplements out there, but also the supplements that you mentioned, protecting, keeping it balanced, but also helping potentially with ulcers too. And, things like that, finding the right supplements for your horse, if that should be the case. But yeah, and any last closing recommendations, one for, horse owners who maybe have a horse that have not had any founder problems, but they might display some, they may be a little overweight, they may be displaying some first early signs of metabolic problems. And then also to, the owners who are managing a horse that has foundered in the past and is very prone to laminitis.
This, number one, your vet's your best friend. Make sure you work with your vet to identify any kind of risks. Dietary and management, keep your horse at a good, healthy body condition score. Obesity is your enemy. So try and keep them, if they've had problems, 4.5 to 5. If they haven't had problems, I try not to let horses get over. And regular exercise, because again, horses are happiest and healthiest when they're at a good body condition score. They are active, comfortable, nutritionally provided individuals. So
yeah, absolutely.
And then know your horse and watch for anything that's out of the ordinary.
Yeah. If only we were so in tuned with ourselves as we are with our horses' nutrition.
Yeah.
We would be, we would be, the ultimate
Yep.
health nuts in the sport world, right?
Yep.
Katie, thank you so much. I think next month we're going to connect on nutrition plans for performance horses. It's the fall time where we're wrapping up show season with fall shows. So really diving in deep of how to really keep your performance horses at peak. So I'm really looking forward to that when we get to connect again next month. But this has been great. Fall laminitis, all horse owners are like, oh yeah, they hear it all the time, but having the rundown and just understanding how unique it can be for each horse and how sometimes it can be that silent, like slip in there and you not even realize it with a horse that you have or a pony. So thank you so much. And thank you so much to Kentucky Equine Research for being our From the Expert sponsors. And of course, again, Katie for being our nutrition expert. So thank you so much. And we are going to post this on our website and we will share the slides. And if you're listening through our podcast, we will have these slides on our website, midsouthhorsereview.com, so you can reference them. And we look forward to next time.